In 1973, at Youngstown State University, I started doing the first of a long lifetime pursuit of research into the body electric, starting to measure the voltage, the amperage, and the resistance, the galvanic skin resistance, the impedance. We were measuring brainwave and heart rate and other different electropotentials of the body. In order to measure skin resistance, we have to apply a signal. We have to apply a voltage, an amperage, a current, and then we look at how the body resisted, and that's how we tell the impedance or resistance of a circuit. This application of a signal could be verified and used as a stimulus. So I started working on this, and in 1985 I started building up a procedure of test and answering different questions at the Academy of Applied Bioquantum Technology in New Mexico. We had done a series of studies to find out about different factors of the body electric. And what we had found is that the body electric, if we stimulated it correctly, that we could stimulate learning, we could stimulate sports. Because we were stimulating osmosis, a little fluctuation of a direct current could create an increase in osmosis. All enzymes work by osmosis. Everything works because of some type of enzyme transport system that was improved with a slight little microcurrent electrical stimulation. And we validated this with a host of different research that led to the 1989 registration of the EPFX, electrophysiological feedback zeroid in America. Being able to look at varying different reactions of voltammetric stimulus to then see if about reactions of hoursodes, isodes, and a host of other different things. In developing this technology over the years, I started publishing different research articles and finding out that we could stimulate intelligence, stimulate the body potential. We could stimulate muscles. We did a host of different research showing that people can now lift a little bit more, hold their breath a little bit more, as we started to look at different things of the VARHOPE. Voltage, amperage, resistance, hydration, oxidation, proton pressure. In other words, being able to measure acid and alkaline states. As we started to do this, we were developing a whole new approach to medicine, approach to electromedicine, biomedicine. And this was starting to come together and pull together as we started to find out different ways to help people. Recently, many different studies on transcutaneous DC stimulation, TDCS, TRNS, CES, cranial electrostimulation, as well as the biofeedback GSR stimulation. Now this host of research is flooding the world and telling everybody that this electrical stimulation of the brain can increase intellect. But we had developed a system over this last 30 years that could really work better. Most patients, 85% or so, are a little more acid. Some are extremely acid. So most of our people, because what makes us acid is stress and meat, potato diets and different electrical, contacts, toxicity, and this makes us acid. Acid patients will need electrons, and thereby we need to give them electrons. And all of these different stimulations of TDCS and TRNS and CS, they're all giving electrons. But you see, for the 15 or so % that are alkaline, giving them electrons isn't helpful at all. For those people, we had to use a different procedure of using a spike wave, which would then be able to draw out the excess electrons and stabilizing them. So we had to develop, first off, a system dedicated to the ideas of complete health. First, don't hurt, as Hippocrates told us. This we needed to look at and stick to, and the idea of validation and verification by doing studies. A host of different studies leading to the 2014 clinical evaluation of all of this work being done by the SCIO eductor technology. We also had to make sure that we set up training for these people to be able to do this, because home use of this would not really be the best way. These would be expensive machines. Our machine is around 20,000 euros. And these would be expensive, and they need to be operated by a therapist trained in what is vasovagal risk. We need to be able to train these people, because sometimes the person might slip into a faint or something. And we needed to be able to turn the machine off when the work is being done. So we had to build alarm reactions that we charted out first way back in those 1985 researches that we did back in New Mexico. We had to be able to find out and to help people to understand just how to do this in superlearning, and that they really do need to get an international license in biofeedback to really show the world with a piece of paper on the wall that yes, they're doing it correctly. We need to be able to provide proper intake forms for the people who are going to be doing this, proper contracts, proper establishment of the business, proper advertisement, what you can and can't say, the handouts, the bibliotherapy, the take-home work that you might have. Because what we found in our research now recently is that one session of this can stimulate the intellect in a patient, a subject, a child, for anywhere from 2 to 3 days. 2 therapies done within a couple of weeks, and that effect can last longer, maybe even more than a week. And the very interesting research published in the BBC is that just 5 sessions over a 2-week period and 6 months this effect can last. 6 months the student can be improved. The sport athlete can be improved. And then later on they just need a little tune-ups. They might just need a little bit of help. And if we can get to the lifestyle with the SOC and educate people on what to eat, and especially educate them on what not to eat, we can really help them, and we can get to their attitude, and the attitude determines their altitude, how far they can go. As we put this together, we started to see that virtually every parent wants his child to be better. And if the cost is $200 a session, and you're talking about 5 sessions, let's do an introductory price of $650 for those 5 sessions. $650 and then a couple of tune-ups during the course of a year. This is a small amount of money to help your child become better, smarter, pass that test. We had one of the students now that was in our study, and the parent came to me and was crying because she had only seen her son's ability to become a truck driver, and now he's starting to talk about becoming an electrical engineer. You see, because all of a sudden tapping into the potentials of the human spirit. We've developed a bunch of take-home super learning tapes with specialized music, specialized frequencies, specialized visualization to help intensify this effect at home. Different types of music that they could play during the day, play during study, and etc., to help make themselves better. So a whole program that we put together, and a whole different book on how to become a super learning therapist. And what parent doesn't want to make their child better? What parent doesn't want their sports athlete child to be a little bit faster, a little stronger? And that's just what this machine has been proven statistically to do, and registered to do, and legally registered here in Europe to do all these different functions. So I wanted to present you a simple little review of the technology and some of my different ideas, and now let's look at what CBS has to say.
In our morning round, jumpstarting your mind, an experimental device for stimulating the brain is getting attention. It involves wires and low-voltage batteries. The technique is linked to improvements in memory, mood, and motor skills. It is being tested as a treatment for depression and autism. Dr. Sari Lasanvi is director of the Brain Stimulation Division at Duke University School of Medicine. We're pleased to have her. She's also chairman of the Department of Psychiatry. Tell us what the principle is at stake here.
Well, this is TDCS, which stands for transcranial direct current stimulation. Right. And the principle is, we know that the brain operates on electricity. This is a brain stimulator which non-invasively uses weak electrical currents that literally come out of a battery that are modulated by this device. And you put it on the scalp, and it polarizes the brain, making brain areas charged and more closer to the threshold where you can bring them online or use them to do things like memory function or modulating your mood, for example.
Why do we need this type of electrical stimulation?
Well, we do have effective treatments in the field of psychiatry, but there's some things we still can't treat, such as treatment-resistant depression or autism. We need help in helping people recover function after stroke. And so we do need alternatives to medications and to psychotherapies. Using non-invasive brain stimulation, such as with devices like this, which are very safe, allows us to have new ways to modulate the brain.
Is this related to electrical shock for certain kinds of brain questions that have come up before in medical treatment?
Well, this uses direct currents, which are different from other forms of brain stimulation. They polarize the brain. They don't stimulate the brain. So the safety profile is actually quite good.
We were interested in this story because people are going on the internet and they're creating these devices on their own and using them at home. Is that safe? Does it work?
Well, that is a concern, obviously. We're using these devices in controlled clinical trials, such as a trial we're doing right now in the treatment of depression, where we're doing it under medical supervision. It matters where you put the electrodes on the head, of course. So doing it at home is a concern, but there are places you can go on the internet that are advertising this type of technology to enhance normal function.
But is it risky?
There are risks, certainly, and so I would be concerned about that.
But have you done it?
Not personally.
Now, wouldn't you want to experiment and see what it's like?
Well, we have done piloting with it, and what you feel is just a slight tingling on the head, then that goes away, and it's painless.
Wow, incredible, fascinating. So nice to see you, Doctor.
Thank you.
Now, our technology is measuring the EEG, ECG, all the different aspects of the body electric. So we're not just treating, we're actually measuring. And we employ a therapist. So this is a monitored system. Our technology is at least 20 or 30 years more advanced than the other technologies that are happening in this world of brain stimulation. Let's look at another recording from the Discovery Channel.
Carl is stopped.
Okay.
Now Alan prepares to give him a jolt of inspiration. This cap sends a small positive electric current. The technique is called transcranial direct current stimulation, or TDCS, and it's designed to mimic the pattern of brain activity found in savants.
Okay, how do you feel now?
It's a little bit of tingling.
After stimulating with TDCS, Carl tries the matchstick problem again.
Very good, congratulations. This is a case of mental fixation. We can't help but look at the world through the frames of what we already know. We see a filtered view of the world, not all the details. But Carl, after transcranial direct current stimulation, was able to see the solution.
Alan's creativity temporarily changed the way Carl's brain worked. It appeared to give him savant-like abilities.
And as we look at this incredible explosion of technology in electronic stimulation of the human potential, it's incredible, and the science is there, the registration is there, legality is there, but you need to do the training. And just think about the amount of money that you could be making, a couple of $1,000s a day, relaxing in the home, doing home therapy to make children more intelligent. What a world, what a life. This is Desiree Dubonnet. I hope you can see this and pursue it. Ask questions. Bye.